This presentation continues with the porcelain fused to metal restoration and discuss the pre-treatment of the metal surface and the application of porcelain. When we're talking about metal surface, we're talking about, for porcelain fused to metal, we're talking about dental alloy that are specifically designed for ceramic applications. The treatment of dental surface prior to porcelain application varies with the base metal elements such as tin, indium, and iron to precipitate on the surface and produce an oxide film. Alloys that contain greater amounts of base metal elements, such as non-precious alloys, produce a thicker oxide layer. In contrast, high gold content alloys with far lesser amounts of base elements produce fewer surface oxide. For this reason, bond strength varies greatly depending on the types of alloy and surface pre-treatments. So in other words, before we start thinking about the porcelain that we're gonna use for fabricating the porcelain fused to metal restoration, we have to know what type of ceramic dental alloy was used to fabricate the coping or the framework, and also reading and understanding the manufacturer instructions. What are the procedures to pre-treat that alloy to receive the porcelain? The greater content of base alloy or non-precious alloy in the coping, the greater is the oxide layer that forms on the ceramic coping. So it is very important, because if we don't understand the properties of the ceramic dental alloy, then we don't understand what kind of porcelain we should use that will be compatible with that alloy, and therefore the bonding between the porcelain and the framework will suffer. Use any of the following procedures listed to pre-treat the metal surface. So they are listed in order from first step, surface grinding, and this is a finishing procedure that is best accomplished by using a carbide burr and grinding in only one direction. If you leave the surface rough, it can create stresses within the porcelain veneer. From this point on, handle the casting with forceps or the like to prevent contaminating of the porcelain bearing surfaces with oil and dirt from your fingers. Use the step 2 is using ultrasonic cleaning with distilled water or steam cleaning. So abrasive particle, dirt, and oils that have attached to the surface of the coping during the grinding can be removed by using distilled water in an ultrasonic unit. If oily residue remains on the ground surface, it will bake on the surface metal as a contaminant. Therefore, the bonding between the porcelain and the surface of the ceramic metal, it's not great. Also, steam cleaning is effective for this purpose. The third step will be heating under the vacuum at 1040 degrees Celsius for 2 minutes. This is the term called oxidation, which describes the heating process used to produce a controlled oxide layer on the metal surface and to dispel gases absorbed by the metal during the casting. So this procedure also has the purpose to decontaminate the coping or the framework. By eliminating those gases that were trapped inside the metal. If these gases aren't released before the porcelain is applied, they could cause the opaque to bubble at the interface between the metal and porcelain. These gas bubbles will eventually migrate to the surface where they become visible. The resultant holes can be repaired, but each time the porcelain is fired under the vacuum, the risk of escaping gases increases. So in other words, if this decontamination heating process is not done, the risk of the contaminants and gases trapped on the surface of the ceramic dental alloy will affect not only the bonding between the porcelain and the metal, but also later on during the baking of the porcelain, the gases will try to escape from the metal surfaces through the porcelain, creating bubbles into the metal. Deoxidizing with acids and sandblasting with aluminum oxide. So we talk a lot about different procedures to condition the ceramic dental alloy to receive porcelain, one of them being pickling. So deoxidizing with acids, meaning pickling the surface of the alloy to receive the porcelain. Some metal ceramic alloys produce excess amount of oxide that decrease the bond strength and darken the metal surface. Sandblasting the metal surface will deoxidize the casting and to some extent expose fresh metal to reoxidation. Do not deoxidize castings made from high gold content alloys. These alloys produce fewer surface oxide, and deoxidation could strip the metal surface of its base metal atoms. So again, it's very important to understand what kind of ceramic dental alloy we are using and also how we should pre-treat and or condition the alloy to receive the porcelain. Heating at atmospheric pressure. A second oxidation finish might be indicated to improve the oxide film quality and color. Each metal ceramic alloy, when properly oxidized, will have a characteristic appearance. Precious metal alloy content thin should have an optimal oxide film composed of dense thin oxide, which appear grayish-white in color. Repeat heating as needed, but take care not to overheat the metal surface and disturb the fragile oxide film. When you observe interfacial bubbling on the porcelain, it is best to strip the framework and lightly refinish the metal surface with a carbide burr before proceeding again. So in other words, if we did this procedure and we applied the first step of porcelain, which is the opaque layer, and we see there are some bubbles in there, instead of continuing with building up the porcelain, the best idea will be to strip the porcelain and restart conditioning the surface of the metal again and make sure that the metal has that oxidizing layer to receive the porcelain. What are some of the metal conditioning agents? Use metal conditioning agents to enhance the metal ceramic bond, or when using silver bearing alloys to prevent staining of the porcelain veneer. Gold metal conditioners. The 24 carat gold metal conditioners produce the apparent silver content on the surface of the alloy when properly fired. Theory predicts that the silver content on the surface drops sharply to about 15% due to the addition of gold. As the percentage of silver decreases, so does the probability of discoloration. Because gold metal conditioners do not form oxides, the bond strength between porcelain and metal might diminish using this technique. So this is applicable only for gold alloys. Ceramic metal conditioners. These materials act as a barrier layer between the metal and the porcelain, preventing the porcelain from contracting the metal surface. How to use the metal conditioners. To use metal conditioner, prepare a thin matrix of powder and liquid. Apply a thin coat of conditioner to the metal surface to be conditioned. Dry the coat of the conditioner and then fire it to a slight sheen. Remove the frame and cool it before applying the opaque porcelain. When using a metal conditioner, follow the manufacturer instructions regarding the porcelain application. So this is illustration how the copings, one coping goes through the whole procedure of conditioning to receive porcelain. So on the left, we have the grinding of the metal, the finished coping. In the middle, we have the coping that was sandblasted with aluminum oxide. And on the right, we have the coping that is oxidized, forming the surface oxide that are used for the chemical bond between the porcelain and the coping. Opaque porcelain. Opaque porcelain serves a threefold purposes. It hides the color of the metal. It's establishing the color of the overall color of the restoration, and it complements the shade of the porcelain, the build-up porcelain that will be applied afterwards. And it's very important that the opaque porcelain has a good bonding with the metal surface. How to apply the opaque porcelain? So we have to measure out the correct amount of opaque powder into a dish. Now, it's good to mention here that this method talks about the opaque that comes into a powder that needs to be mixed with water or a special liquid. Just to update on this, there are different opaque pastes that they're already pre-mixed and they come in syringe. So they're already ready to be applied on the surface. But if we're using the opaque powder, we have to make sure that we, first of all, the bench it's clean and there are no contaminants on the bench. Everything that it's used, it's clean. So if we're using a porcelain tray, make sure the porcelain tray it's clean, and also all the instruments that are going to be used for applying the porcelain. So the opaque powder, it's mixed with a special liquid to form a paste, and then that can be applied on the surface of the coping. The modeling fluid, it's a combination of glycerin and distilled water that prevents the porcelain from drying out. Before applying the first coat of opaque, apply an initial thin or a wash of the opaque porcelain. So it's more like you paint the surface of the coping with the opaque porcelain. You fire that at the specifications of the manufacturer for the program for the porcelain oven, and then the second coat of the opaque, it's applied in a thicker manner. This initial application increases the wetting action of the opaque to the metal. Using a number 6 sable hair brush, slightly moisten the cast with fluid and apply a thin slurry of the opaque. Place the casting on the firing platform, pre-dry. Pre-drying is not necessary, but in some cases, it is necessary to keep it there for a minute or two before firing, so any water moisture that will be in the opaque porcelain, it's evaporated before we we bake it. And firing the cast at 600 to 960 degrees Celsius at 33 degrees Celsius per minute in a vacuum. Again, this is viable for some types of porcelain, but if we're using a porcelain, before we're using the porcelain, make sure we understand and we know the firing temperatures of the porcelain for each state of the porcelain from the opaque to the incisal and other modifiers of the porcelain. Not all porcelains are using this formula of 600 degrees at 32 degrees Celsius per minute. So to apply the first coat of opaque, pick up a ball of porcelain on the brush and let it slightly contact the metal surface. Move the brush down the metal and opaque will follow in a thin film. Continue to repeat this procedure until the entire porcelain bearing area is covered. It is important to work quickly so the opaque stays wet before it's condensed. Gently vibrate the opaque porcelain to smooth and condense the surface. Allow the casting to completely cool between porcelain application. Also, re-wet the surface with distilled water before making any additions of porcelain. So this is the procedure. The first layer of the opaque, after firing, we may see that we can still see some of that metal underneath, and that's okay. And the second layer of the opaque, the whole idea is to cover any spots that might be in from the coping to see. So it has to be more consistent and make it as a little bit thicker as a paste. So like I said, there are different type of opaque porcelain. They might come as a powder that it's mixed with modeling liquid. It can come in a syringe or also it can come in a spray. Opaques comes in different shades to match the other porcelain, the dentine and the incisal porcelain. So it comes from bleaching shade all the way to the darker shades. So this is how the porcelain application should look after the firing. It should be a smooth surface and also uniform thickness. So it shouldn't be one area too much porcelain and one area not enough. Also, when we apply the porcelain, very important, especially for the second layer, make sure that it's covering the metal. So no metal after the firing of the second opaque layer, no metal should be exposed. Before firing the porcelain into the porcelain oven, the opaque porcelain, we have to dry it. So dry the opaque in front of an open furnace door or draw the moisture away with the tip of a facial tissue. Remove any opaque porcelain from the inside of the casting or the non-porcelain bearing areas. Firing. Place the casting on the firing platform of the porcelain oven. Insert the crown into the furnace and start with the vacuum part. Properly calibrate the furnace. If you have done so correctly, the firing opaque should have a matte finish, shouldn't be glossy, shouldn't be shiny, and more like a slightly sheen or eggshell surface. If the opaque has a glazed appearance or it's shiny, that means the temperature that was used to bake the opaque porcelain was too high. And expert ceramics always fire the porcelain to maturity as identified by its appearance. Apply the second opaque layer in a thin, even covering, eliminated all metal shadows. Fire the second layer at the same temperature as the first. The casting and opaque should now measure at least 0.5 millimeter in thickness, allowing for 0.2 millimeters for the opaque layer. So the opaque layer is actually a very thin layer applied to the surface because we need to have enough clearance to apply the dentine and the incisal porcelain to build up the restoration. So condensation of the porcelain, why is that important? Before we fire, every time we add porcelain to the crown, we have to try to dry the crown before using the oven to bake it. And why is that important? because the mixing liquid used to be mixed with the powder, the porcelain powder, contains water. And if we don't eliminate the water from the porcelain prior to baking the porcelain in the oven, what's going to happen? The porcelain is going to try, during the baking time, is going to try to eliminate the water. It creates steam that creates bubbles into the porcelain. Therefore, we're going to have more problem. So the condensation or the eliminations of extra liquid or extra water from the porcelain, it's a very important step that has to be done before the porcelain is baked. Every time we apply even a thin layer of porcelain, we have to do this condensation. And there are multiple types of um, way to do the condensation. One way is to use an instrument to vibrate very, very slowly the crown, so the liquid from the porcelain comes towards the surface of the porcelain, and then use a tissue like a Kleenex tissue to draw the moisture out from the porcelain. Okay. Another method will be to use a dry brush, a dry, soft, large brush, and brush the porcelain. And again, that procedure will bring moisture out from the inside the porcelain towards the surface of the porcelain. And then we can let that crown to dry on the oven before starting the program. And the third way would be just to let the crown on the tray of the oven, on the muffle of the oven, just let it completely dry there before starting the program. And we can see also how the porcelain looks at microscopic level when the water is not taken out from the porcelain. We see that the distance between the molecules is bigger. Therefore, when we're going to bake it in the porcelain oven, it creates that steam that creates bubbles in the porcelain. By applying the condensation methods, either one of them, the water, it's the moisture and the water, it's removed from the porcelain, and therefore the particles are tied together. And when we bake it, there is no water to create those bubbles. Okay. Opaque effects. Intrinsic staining on the fired opaque can help provide a basic color background to the crowns. It should not be used to stimulate special effects such as check lines or decalcification marks. What this idea is that sometimes to customize the color or the shade of the natural dentition of the patient, we need to alter the color of the opaque porcelain, right? So we may add, this is the time to add stains. So after we fire the second opaque layer, we can add a very thin layer of stains. But again, this is just to kind of give a general idea of the shade. So let's say a patient has very dark shade and it's something in between, let's say C3 and C4, right? If we use C4 is too dark, if you use C3 is too light. So what we can do, we can add a little bit of stains on the opaque layer just to kind of darken that C3 shade to get it in between C3 and C4. So that's the idea of using stains in this at this stage. This is not intended to do any characterizations of the crown. So let's say the patient has those white spots on their teeth, or maybe they have a crack line, or like a little bit of darkness on the surface of the tooth. This is not the time to do that. That will be done after the incisor porcelain is applied. So after the crown is built. So this is just to kind of give a general color to the build-up porcelain that we're going to use. Some of those color opaques are white for making the color lighter, gray for kind of shading the tooth for the body and incisal area, lilac gray for gray shading both the body and the incisal area, pink for reddish discoloration spots to produce a warmer tone in the standard opaques. Also, pink can be used towards the gingival, towards the margin, to kind of blend in with the gingiva of the patient. So kind of creates a nice transition from the gingiva of the patient to the crown. And brown from increasing the brown color at the cervical area of opaque. If the special opaque powders above are not available, try using other standard opaque powders or porcelain stains. The more practical use for opaque staining is at the cervical and incisal area. Depending on the age of the patient, some cervical staining might be necessary. The effect might range in color from light brown to dark brown, with varying amounts of other modifiers such as orange and pink mixed in. To lighten the incisal, mix white opaque with the chosen opaque shade, or use lighter shade opaque porcelain. To create more translucency at the incisal, mix blue, violet, or gray opaque with the chosen opaque porcelain. So this is the application of the opaque porcelain. And just to summarize very fast, we have to make sure that, first of all, we know what kind of ceramic dental alloy we're using, how to precondition the surface of the alloy to receive the opaque porcelain, how to mix the porcelain or what kind of opaque we're using. We're using powder that needs to be mixed with the liquid. We're using a paste, we're using a spray. Also matching the shade of the opaque with the shade of the patient. What is the final shade of the restoration? Okay, so if a patient has a A1, which is a light shade, we're not going to put an opaque porcelain that it's C3, which is very dark. Okay, so we have to match. We put an A1 for the opaque, and then we're going to continue with the dentine porcelain A1 and the incisor porcelain corresponding with the shade. Then we apply the first layer of the porcelain, the opaque porcelain. We let it dry, or we can use one of the condensations method to draw out the moisture from the opaque porcelain. We fire it in the porcelain oven following the manufacturer instructions for the firing program, and then we are ready to fire the second layer of the opaque that is a little bit thicker and also more consistent. After the application of the second layer of the opaque, we have to make sure that there is no metal showing through the opaque porcelain. Okay, and then if there isn't necessary to use any stains to alter the shade of the opaque, after the second firing of the opaque, that would be the time to do it. But this is just in general for the overall shade of the tooth and not for the characterization of the tooth. If you have any questions, please ask. Thank you.